Good evening, everyone. Welcome to our first session, Dr. T's Q&A. We're going to jump right in. I have a number of questions that people are very interested in getting answered. All right. So, our first question is, I have had 3 periods this month. I have no pain other than my usual cramps. I've taken several pregnancy tests and they all came back negative. I'm only 22 years old and I don't think it's menopause. I was on the Depo shot when I was 18 or 19 but have been off since. I have no period for 1 year and I stopped the Depo shot and now my periods are very irregular and I don't know what could be wrong. Well, this could be a number of things actually. This is very good information. So let me start off by saying that the Depo shot or any other man-made hormones changes the way that our reproductive system is working. So it's going to alter your hormones in order to accommodate for the purpose of the shot. So it's likely, since you did take 3 tests that all came back negative, that you're not pregnant. That means that there's not a high enough concentration of the HCG hormone, which is the pregnancy hormone, to cause a test to be positive. You were correct in saying that you don't think it's menopause. You're too young to be going through menopause. However, it could be that you're going through a period where your hormones are rapidly fluctuating from being on and off of the Depo shot, and so they basically need to be balanced out. In order to do that, I would recommend that you discontinue the Depo, and take a more natural remedy that will balance out your hormones for at least 3 months until you are seeing that your cycles are again regular and you're not having any other unwanted symptoms. That is what I would recommend. Of course, if you have any questions as to what exactly you should be taking, feel free to give me a call or send us a message. Next question. All right. Hello, Dr. T. I have enlarged lymph nodes under the armpit. I don't have any other symptoms and I feel completely healthy and normal. I don't have a fever or any weight loss. I also don't have any other symptoms of breast cancer. I've had this for about a year, maybe even more, and now I'm really scared because it won't go away. Okay, I understand that you're scared. Whenever we have something going on with our body that is unusual, it is going to cause fear, so that's normal. The enlarged lymph nodes could be due to hormonal fluctuations. It could be something that is hereditary. We don't want to jump to thinking that it is cancerous. However, I would highly recommend that you have some lab testing done and at least an ultrasound just to rule that out. Without these tests, there's no way to know for sure what it is that's causing the enlarged lymph nodes. I hope that's helpful. All right. Next question. I am 24 years old, Dr. T. I've just finished my period, which was relatively short and unlike my normal flow. Now I'm experiencing a constant headache and insomnia. whilst I'm battling nausea, as well as to a point as I can't keep food in because I'll throw it up. Please help. I am very scared. Okay. So, it sounds like you could be experiencing symptoms of pregnancy, but I have no idea if you could be pregnant because I don't know if you're sexually active. The headache, the insomnia, and the nausea are symptoms of pregnancy, early pregnancy. However, they are also symptoms of STDs. They're also symptoms of viruses and other illnesses. So there's really no way for us to know. Granted, if you had, let's say, a stomach virus, that would affect or could affect the length of your cycle. So I understand that part of your concern was your cycle being shorter than normal. I would advise that you take a pregnancy test. If that comes up negative and you find that you're still having the same symptoms, I would advise that you go into your general practitioner and that you have some other blood testing done as soon as possible. All right. Next question. I do get a number of questions about the Plan B. Timing is essential. Dr. T, I took a Plan B during ovulation. It was 2 to 3 days after ovulating. Will it still be effective? So my first question to you would actually be, how do you know for sure that you were ovulating? My second question would be, do you ovulate regularly every month? What are your cycles like? The Plan B is designed to be a preventative measure for implantation, basically for the baby to be conceived. Basically for the sperm and the egg to meet successfully and develop, progressing into a pregnancy. So it is critical, if you're going to use the Plan B, that you take it as instructed. Otherwise, you could end up with an unwanted pregnancy. Plan B is not something that I personally recommend, but again, if you have any specific questions as to whether or not it was effective, you should probably have some testing done. All right, next question. I recently found out that I have an STD. I was treated for it on Thursday, and I was wondering, was the STD making my pregnancy test come back negative? Okay, that's a very good question. I don't know what day exactly it is when you compose this question. However, the STD could affect your hormones. However, it's not likely. I don't know which STD it is you're referring to, but the pregnancy hormone, the HCG, that is the pregnancy hormone, is not traditionally affected by an STD. So if you were pregnant, it is likely that the pregnancy test would come back positive if there is enough of the hormone to give you a positive test. Again, that would be for an early test, that would be a day or two before your missed period. For some people, it's a couple of days after. Okay. Hello, Dr. T. I was masturbating and now I am in pain in that area. I have pain in my clitoris. That could be normal depending on how much masturbation took place. I would advise when you're doing so, if you're not lubricating yourself, that you definitely do, that you take some breaks, and also that afterwards, if you're experiencing any pain, you take a warm bath and everything should be fine. If it does persist for days after, then you would need to be seen. Make sure there are no irregularities around the clitoral area or anywhere else. And if there are, definitely you should be seen. All right. Dr. T, I had sex with my boyfriend on the 4th day of my period. We had protected and unprotected sex. He did not finish inside me. It was just pre-cum. There was a concern. I took the Plan B on December 4th. I spotted from December 9th to midday December 11th. I have an irregular period. It was estimated to come on December 31st. I've waited 2 weeks, took 4 tests, and 2 more, this January the 3rd and January the 15th, all were negative. I've had protected sex with my boyfriend on January the 14th. Okay, so thank you for the details. This is actually very helpful in answering a question such as this. So I think one of the challenges you and a lot of other women are facing is determining when you're ovulating if you have an irregular period or an irregular cycle. We do recommend that you take ovulation tests so that you know, and that would help you to time things a little bit better. Now, it is a misconception by many that pre-cum is not going to get you pregnant. That is very inaccurate. There are a number of ways, if given the right conditions, if you're fertile and ovulating, that pre-cum would get you pregnant even during foreplay. There are a number of ways that this could happen. Now, also you mentioned that you took the Plan B not long after having unprotected sex. That, of course, decreases the likelihood of you becoming pregnant because it would inhibit or prevent the progress of the sperm and the egg meeting to develop into a pregnancy. And again, you've taken numerous tests and they've all come back negative. So the spotting could just be from irritation of your uterus. It could be from ovulation. It could be from a UTI. It could be from a few things. I would recommend that if it persists beyond a week and you still have not seen your cycle and your tests are still coming up negative, then you probably need to be seen to get some formal testing done in office. All right. Dr. T, I am experiencing pelvic pressure. It feels like something is coming out of my vagina. It's not painful, but it's very uncomfortable. I am 53 years old. Okay, so I do have a couple of questions regarding that. I don't know If by chance you've completed menopause, if you still have even irregular cycles at all, um, I do appreciate that it's not painful. It could be a cyst that is usual when we're talking about pelvic pressure, and not necessarily pain. It could also be a fibroid, which they tend to grow fairly rapidly, start off as pressure, and then end up quite painful. So honestly, in order to give you some more direction, I would have to have a few more of my questions answered, and I'm hoping at this point that the pelvic pressure has subsided, and I don't know how long you were even experiencing it. So, again, if you'd like to tune in and you want to give me some more answers, or you can send us a message or give a call to our toll-free number, I would be more than happy to help you. All right, Dr. T, I had dry sex with skin on skin but no penetration. Should I take the Plan B? I'm not on birth control. I'm 18 years old and scared I will get pregnant. Okay, another question about Plan B. I understand your concern. Because there was no penetration, it's not likely that you would fall pregnant. However, there is still a chance. I don't know if at the time you did it, how close you were to ovulating. In the event that you were concerned with falling pregnant, I don't know if you actually took the Plan B or not, but that would be a preventative measure that you could use. Again, not something that I personally recommend. I understand that you're not on birth control. And my advice to you would be, in the future, even if you're going to have dry sex with no penetration, that you do so using a condom. Okay, next question. Dr. T, I am having pain consistently on my right side, and I'm bleeding every time I have sex. I am 25 years old. Okay, my first question to you actually would be the pain on the right side. So, how long have you been having the pain on the right side? Okay. All right, so a couple of weeks. The bleeding when you have sex is a concern because that means that there's likely something going on with your uterus. There's some sort of irritation or inflammation, so that when it's agitated, that it would cause some level of shedding. That's what bleeding would be, unless again you have some cysts. However, the pain on the one side is concerning because that could be an indication of an ectopic pregnancy. Okay, so what I want you to do is I want you to press down on the right side where the pain is and let go. Tell me if the pain is worse when you let go or when you press down. I'll give you a moment. Okay. So the pain is worse when you press down. That's actually a good thing. If the pain were worse when you let go, I would be very concerned about an ectopic pregnancy. So what I'm going to advise you to do is to refrain from having sex for a couple of weeks. Take some warm baths and order our endo oil, because that will help to expel cysts if you do have it. Hello, Dr. T. I am pregnant and was wondering if I can eat sushi during pregnancy. In short, yes, you can eat sushi during pregnancy. However, in moderation, it is not recommended that you eat much at all because of the raw contents and because of the amount of iodine that could be harmful to both you and your unborn child. So, eat a couple of pieces and then find something else to cure your craving. All right. Hi, Dr. T, please help me. I've been having blood clots on my pad and bleeding through my clothes and been on my period for 14 days. Okay, I am sorry that you're going through this. 14 days is a pretty extensive amount of time. So let me ask you, were your cycles normal prior to this? Did you skip any and then have this extended 14-day cycle? Okay, so if you're not ovulating regularly, then you're more inclined to have abnormal cycles. This one is definitely abnormal. At the 14-day mark, I would want to be sure that you're not losing too much blood. Now, our blood does regenerate roughly every 24 hours. However, if you're losing too much during the course of the day, it could make you anemic. The clots could be due to cysts, could be due to fibroids, it could be due to a miscarriage. It could be due to actually a number of things. Sometimes, a lot of times actually, with women that have irregular cycles, they have something called PCOS. And that is polycystic ovarian syndrome. Now, during that time, your body is creating cysts, pretty much. So, when we're fortunate enough, when we have our cycle, the cysts will dispel on their own, which would come out looking like clots during your cycle. It would make your cycle heavier, it would make it longer. However, it's actually a good thing because the last thing you want are the clots to sustain themselves within you and to grow and persist. So I would advise that after a couple of weeks, if you're still experiencing this, that you at least have a blood test done to make sure that you're not falling anemic. I would increase my iron intake. And if you feel cold or faint, I would definitely go to the ER. After you've gotten all of that stabilized, do by all means give me a call, schedule an appointment so that we can treat your PCOS, because that is actually something that I specialize in, and get your hormones balanced. We can work on that so that you no longer have PCOS and so that you can see a normal cycle and don't have these concerns any further. Dr. T, I am pregnant and I've been having morning sickness for a while. I'm in my first trimester. I've tried everything but nothing works. What do I do? Well, I'd like to know first what you've tried. Okay, so what I would advise, get some saltine crackers, just regular run-of-the-mill saltine crackers. and eat on those. That should resolve your morning sickness pretty quickly. If it persists past that and your hormone levels are all normal, give me a call and we can have a talk. Next question. Dr. T, I am afraid that I might be pregnant. That's not really a question. However, I would say that you would probably benefit from taking a pregnancy test. Are you having symptoms of pregnancy? Have you missed your cycle? Are your cycles normal? Okay, that's fine. We can do that. Give me a call anytime this week and we can schedule a consult. It's a good idea. Dr. T, my last period was on Halloween, and I started my combination of birth control the same day. I had sex on November the 17th and still on the pill, but I stopped taking them on November the 14th because my now current ex broke up. I've been having brown discharge for 3 days now. Could I be pregnant? In short, yes, you could be. If you were sexually active during the time that you were ovulating and you missed a few of your pills, it is possible. Even when you're on the pill, it is still possible. It's not likely, but it is still possible given all of the right conditions. I would advise that you take a pregnancy test. I'd actually advise that you take two. Get 2 different brands, take them at 2 different times, and make sure you take them first thing in the morning when you urinate, before you eat or drink. Dr. T, I don't know if I'm pregnant, and here are my symptoms. Missed period, tender, swollen breast, nausea with or without vomiting, increased urination, and fatigue. I am 13 years old. Well, young lady, I would have to say that your symptoms are all indications of pregnancy. I would advise that you take one, preferably 2 tests, by 2 different brands. Take them in the morning before you eat or drink. If you were at any point taking any sort of birth control, oral contraceptives, discontinue those. If you're on any types of medications, I would hold off on taking them until you know for sure that you're pregnant. And as always, if you have any further questions, you can give me a call. Dr. T, I had sex Monday and have been bleeding since. I'm supposed to get my period tomorrow, lining up with my birth control. Is this normal? Okay, so I would have to know some things specific about the bleeding. Is it red? Is it brown? How heavy is it? Are we talking more so spotting? Have you experienced this before? Are you there? Okay. Well, darling, I would love to advise you, but I'd have to have a number of questions answered so that I could advise you in the best way. So how about you give me a call, and we can discuss it further. Okay, this will be our last question for the evening. Dr. T, hello. I have a concern regarding my period, which is around 10 days late now. I moved to a different country a week ago, and I guess the 13-hour time difference, change in environment, and terrible jet lag all could have affected my period. Today I discovered light spotting, mild cramping, and feel a little more sensitive overall. The thing is that on October the 10th, I also had unprotected sex with my partner. He did pull out well before finishing, but it's still a doubt in my mind, and I just want to know. Okay, well, you were definitely right in saying that the travel, specifically when you're traveling through time zones, is going to affect your body. That is definitely something that happens. And it could be one of the reasons that you're experiencing some unusual symptoms. Now, as far as the spotting and the cramping and feeling more sensitive overall, that could be due to PMS. It could be due to early pregnancy, especially since you did have unprotected sex. I understand that you said he pulled out well before finishing. However, as I was discussing earlier, that does not prevent you from getting pregnant, because pre-cum, as we call it, is expelled during intercourse and does have the capability of ending in pregnancy. So, the only thing I can tell you to do, the best thing I can tell you to do, would be to wait until you've missed your cycle, or at least a week and a half, 2 weeks after your travels, and take a pregnancy test. At least one, first thing in the morning. So that wraps up our session for today. I hope the information was helpful, and I'm looking forward to seeing you next week, same day and time. Q&A with Dr. T. Take care.